great. Hi, everyone. Chris here. I'm here with Dr. Dempsey, and we are doing a special Facebook Live tonight for you all about coronavirus and what you need to know, and some immunity boosting tips as well. Obviously, coronavirus news is everywhere if you turn on any TV station, and Dr. Dempsey's practice is located in Westchester County, which is, of course, in the news everywhere with the outbreak here. So, I'm just going to bring it right over to you, Dr. Dempsey. Corona, let's take a deep breath before we start here, because it's really
I know.
a stressful time. So what are you seeing? What are people asking you in your practice right now about coronavirus?
Yeah, unfortunately, fear is up right now. We were already a little fearful when it started infiltrating different places in the United States. Yesterday morning, they confirmed that a man who lived close by to the practice, actually, probably about, 15 minutes away, has been sick actually for a few weeks, and finally went to the hospital and was diagnosed. And the issue is, so everybody's scared now, right? So people, I have patients who live in that same town, patients who live nearby. The issue is that he's been sick for a while, it sounds like, definitely since February 22nd was when he exposed a bunch of people in the area. And so that means, he could have gone elsewhere. Other people could have been exposed. So it's not going to be confined to that one town. So the reality we're in right now is that the virus is probably pretty widespread in terms of exposure. It's hard to imagine that it isn't, because of how quickly people get infected with this virus. So it's there in the community. I imagine that there are people out there who have cold-like symptoms or flu-like symptoms, who are fighting it off, don't even realize they have it, and are fine.
So,
We're hearing about the severe cases, the cases that are winding up in the hospital, and the ones that are getting tested. Now, the other issue, and the reason there's been a lot of fear, is because we haven't been able to really test well in New York up until, I think, Monday or Tuesday, when some changes were made at the government level to get proper testing out there, and to allow people to be tested more efficiently and in larger numbers. People weren't being screened, so there was a lot of there could have been a lot of spread in the community without us knowing it.
So what about for everyone out there who keeps saying, coronavirus is no different than the flu? It's the same thing. It's nothing to worry about. What is your opinion on that?
I disagree. I've heard that too, and I've heard doctors talking. I've heard, the lay people talking, certainly the media talking. And so here's the issue. Okay, there are definitely similarities. For some people who are healthy, what they experience as the flu may be very similar to what they experience as COVID-19. But unfortunately, with the flu, we at least have some treatment. We have some medications that can be used. In particular, Tamiflu is out there. There was another drug that was just approved this year for the flu. So we have something, that we can give to people that might shorten the course of their illness. We have coronavirus, COVID-19. We have no treatment for it. Nothing really that can be done except for supportive care. So that's scary. Now, there are pharmaceutical companies out there. There are medical institutions that are studying right now, and I've been trying to follow the work that they're doing. They're looking at other medications that are already on the market, being used for other viruses, to see if there's any activity against coronavirus. It turns out that Tamiflu, that's used for the flu, has no activity against coronavirus. So these are different viruses. So I understand the comparison, because symptomatology for some people may be similar. However, the coronavirus does seem to have more lower respiratory symptoms, greater risk of pneumonia than even the flu, even though the flu has a high risk. And the death rates are different. And I've heard a lot of numbers being thrown out there in terms of what the mortality rate is from the flu versus coronavirus. And so what I'm going on is maybe, evidence that came out today that could change tomorrow, because again, we don't have all the numbers, particularly in China. I don't think we have half the answers, that we need. So if you look at the numbers right now, they're estimating somewhere between 2% and 3% mortality rate for coronavirus. Now, to put that in perspective, the flu mortality rate is 0.1%, maybe up to 0.2%, depending on the season, versus 2 to 3%. So in other words, coronavirus has a higher rate of mortality, meaning that it's killing people at a higher rate than the flu is. So it's very hard to imagine that they're being compared.
So when you see people out there, when you see doctors on TV that are going out and saying, "Oh, just wash your hands and you'll be fine," or "This is enough," or "It's just another case of the flu," I mean, what are you thinking? What do you want to say to those people when you hear that?
Well, look, I know why they're saying what they're saying, because the reality is we don't know. We don't understand everything about this virus. And what we do for other viruses is we say, wash your hands, and you drink lots of water and you'll get through it. We don't want to incite more fear than is already out there. I mean, the American public and the world in general, right, is all up in arms there. Everyone is concerned. The markets have taken a hit. Other industries are going to take hits, right? So this is huge. So I understand that we want to reassure people, because there's a good chance that, if you're watching me today, that you're going to be fine, that you're not going to be exposed, and you're not going to have an issue. But I think that we have to be more realistic, and a little more honest with the public, and so that they understand that yes, they need to wash their hands, but they need to wash their hands better than they're washing their hands now, because clearly people are not washing their hands for 20 to 30 seconds. You have to wash your hands, and you have to sing like "Happy Birthday," the full song before you rinse your hands again. Or one Mississippi, two Mississippi, whatever you want to use, until you rinse them. People are not doing that, right? So could that help? It can't hurt. But the problem is the transmission of this virus seems beyond that. So the thought is that there may be microscopic droplets in the air that may be suspending in the air from coronavirus, that if a person with coronavirus leaves the room and you walk into that room, those air droplets could still be infectious. So that in that case, washing the hands won't matter. You could breathe it in. So the issue is that we have a big issue on our hands, and we don't have the information that we need to truly protect people. And that's my biggest concern.
Yeah, I mean, I agree with that. I'm of a similar belief here, that I think that there's a lot of information that we're not necessarily receiving here. In terms of the numbers that we're getting from the CDC, I know there was an editorial that came out today which said we all, the premise of the article was saying that we all know that these numbers are not where they really are, and I agree with that. I think that we should have started this a month ago rather than this week. Are you in agreement with that?
Yeah. Oh, absolutely. Absolutely. And even up until this week, we were sort of gearing up in the States. We had a few cases out in Washington a few weeks ago, right? So, but all the states were gearing up for this. But, you could only request from the health department to test your patient for the coronavirus. You had to beg them to approve the test. So I've been talking to doctors who are in the front lines, working in hospitals and taking care of patients, and having difficulty even like trying to test them. So if we had tested them weeks ago, because we had access to the testing, because we didn't have to restrict it, and there are lots of reasons why it had to be restricted. But if we did that, we might have known at this point now where the situation is and how bad the situation is going to get.
Do you think that it's going to get worse?
Oh, yeah. Yeah.
What do you predict that we're going to see in terms of numbers of cases here?
So, again, the transmission of this virus seems to be very easy from what I see. So it's going to, but it has a long incubation period. So people remain asymptomatic for a long time. So I'm guessing that, the first people in New York who were exposed, was somewhere around, let's say 2-3 weeks ago. So we're going to start to see the uptick now in cases. And I think this could go on for months. I think we need to be prepared that this is not just going to die down when spring comes. And that's a difference between this and the flu. We don't know about the seasonality of this virus. Whereas we know with the flu, to some extent, we can predict almost that there's going to be a time when there will be less flu around. There's always flu in the air. I've had patients who have had the flu in the spring, but generally speaking, it starts to die down and there are less and less cases. We don't know about coronavirus.
What about traveling? I mean, in terms of people flying right now, do you think that's a good idea? Would you tell people to change those plans? What's your opinion on that?
So my husband is on an airplane right now.
Oh, good.
I couldn't stop him. He said the airplanes are empty.
Really?
They're empty. Yeah, and the flight attendants are saying that people are afraid to fly. Yeah, he's taken, since yesterday, he's been on, I don't know, 4 or 5 flights. He's been all over the place on business. And I've been really worried, of course, for him. He's not a worrier. That's good. So he's doing his business. He needs to do it. But certainly people are thinking about this and are canceling plans. I know I have patients who have canceled their vacation plans for next month with the anticipation that this could be an issue. So the question is, what should you do? I don't know. I think you need to be smart. I think that if you have a chronic illness are immunosuppressed, have chronic lung problems, you probably should lay low. If you're healthy, you have a good immune system, and you might be okay, right? And that's what we're seeing. There does seem to be a discrepancy between who's really getting sicker or not. It's not that I don't really believe that anyone's really immune to this, but I think that in general, there's some people who absolutely should be a little bit more cautious.
What is the definition of a pandemic, just so viewers can understand what that means? And do you think that this is one?
So, well, pandemic just means that, sort of like a worse epidemic. It's
Okay.
like the next step. Pan meaning sort of everywhere, right? All over the world.
Mm.
If I'm saying that correctly, is that
Yeah.
correct? Pandemic involving the whole world. So what was the other question?
Well, people are wanting, I mean, does this fit the definition of that? Is it safe to say that this is a pandemic?
I think in my opinion, we're on our way to a pandemic. I don't know if we're theoretically meeting the definition of pandemic, but I think it's just a matter of time, given the numbers that we're seeing. If you look at the map and the countries, every day we're hearing more countries that have cases. Last night I read that they have cases now in the Ukraine, Romania, a few others. So as it starts to hit all the countries, yeah, I mean, so we're almost there.
What about parents? I saw earlier this afternoon, Hastings is shutting down their school system for the next 2 days to clean. Do you think other school systems here are going to follow suit in that in terms of closing, or what do you think about that for parents who are worried?
My understanding is that there are school districts already in the area who are taking measures. We're getting letters from our school district about how they're cleaning. And my understanding is that they're trying to clean. They're not closing the school, but they're trying to clean things, disinfect things, and they're trying to be on top of it. Yeah, I think I wouldn't be surprised if we started seeing some school closures, if it starts to infiltrate into the community, which I'm predicting. Again, the children do seem to be less affected
Mm.
from the numbers that we're seeing. But I'm not 100% sure about that because I'm not sure I believe all the numbers. But if we go by some of what the experts are saying, that the kids are not as vulnerable, then theoretically the schools might not be as big an issue. Now, on the flip side, a kid could have the coronavirus and not be as sick, not get tested because they have, what looks like a cold. Maybe they stay home from school a day or two, but they are still potentially contagious and still spreading coronavirus into the community. That's the fear. And that would be the reason why you would want to close a school, not because the kids themselves are getting super sick, but they're potentially spreading it to those in the community who are really immunocompromised.
Wow. Okay. And if you can, let's talk a little bit about this Westchester County case. Now, I know that this is something you're watching in the media, as am I, and it's not a case you had anything to do with, and it's not a patient, but help us understand, for people who are watching this on the news, what really happened here. I believe it was a male who was a 50-something-year-old lawyer, correct? Who was from
Correct.
Westchester in New Rochelle, was taking Metro North to Grand Central. His office was over there, and now he's come down with it, and it appears his whole family has as well. And he's in intensive care. Is that?
Yeah, that's what I understand. And I believe that a neighbor drove him to the hospital and has now tested positive for the virus. And yeah, and then all of them, the entire family is now under self quarantine.
And they're calling this the first case of community spread here. Is that?
Yeah, that's right. And I think they don't fit the typical risk factors that we're seeing, in that they didn't travel to the areas where we know were hit first. So the question is, how did this lawyer pick it up? So it must be in the community, and it must have been in the community for some time. And so again, we go back to, this has been going on for longer than we initially thought.
And I saw that, Cuomo made a statement today that he expects to see many, many more cases of this. This is just the beginning, and that's what he said in his statement. Some people were really surprised when he stated that, but so you're in agreement that that's what you expect to see too.
Yeah, again, it just seems that it's so contagious. So if you take the flu, which is very contagious, and you have a family, yeah, sometimes one person gets the flu and brings it into the family, and everybody gets sick. Okay, I have families that I take care of that happens to. I also have families that one or two people get sick, and some of the other family members don't get sick. Their immune system was better, or they washed their hands more, or the other person who was sick stayed in their room more. I don't know why, but I see this all the time. Not every single person in the family gets it, right? In this case, this gentleman was exposed, got the virus, got sick, and every single person in his family is testing positive for it, right? So if that's the case, and the transmission is 100%, if you think about it, then it's inevitable that the numbers are going to skyrocket within the next week or two. I think we're really just a couple of weeks away from see it become a little more widespread, unfortunately.
And now there was also the other case in New Rochelle where, the attendees of the bar mitzvah, we're talking about almost 600 people, were told that they have to self-quarantine as
Yeah,
well.
yeah, correct.
And now the number today went up to almost 1,000. So can you help us understand, what does that really mean? If you have to self-quarantine, what does that mean, and how should you prepare for that?
So self-quarantine, so quarantine is where you sort of isolate, you're separated from people. So self-quarantine means that you do it on your own, right? It's voluntary, you're not required, and you stay in your home. You don't go out to the store, you don't go out and pick up stuff. So yeah, so being prepared, I think, is smart. I think a lot of people have gone out and started getting supplies. Initially, it was looked at as like this fear running through the community. Everyone's crazy going shopping and buying things. I don't think it's crazy. There should be some supplies in the house in case you can't leave.
Mm-hmm.
Water, extra food, things like that. And you're quarantined until you're deemed not infectious anymore. And there will be a number of tests that have to be done, I believe, to qualify as being removed from quarantine.
Now, we saw in the news this week, there was a case of someone who was actually told to stay home, and who actually didn't, and went to a business event, and may have infected other people. So what would you say about that? If you are told to do this and you do the opposite, what do you have to say to those people out there who think, oh, I'll be fine, it doesn't really matter, and then they may have infected hundreds of other people?
It's so selfish. And this drives me crazy also. I mean, let's not even talk about coronavirus here. Let's just talk about the flu, right? So many people, they have the flu, but they have a business meeting. They sneeze and cough on everybody, right? and everyone's sitting there, they don't want to get sick, and it's not even coronavirus, right? But who wants to be sick, right? So people are really, and I get it, they have work to do, they have responsibilities, but it's not fair to others who are in a different position, whose immune system is different, who might not be able to continue working while they're sick. Or people go out to the stores, or people go out, right, and infect people. So with coronavirus, I mean, this is a deadly virus. It looks like it's deadlier than the flu, and I understand the flu is bad too, but and so you just risk hurting other people. And this is a time when you really have to say, you know what, you got to take care of yourself, and you got to take care of others, and you got to isolate. And I think it's selfish not to do that. But I understand that impulse. I mean, if you have commitments, and you don't feel that bad yet, you kind of think, oh, I'll push through it. But this is not that type of virus to fool around with.
So if you're in New York and you're in Westchester County and you're worried that you could have coronavirus,
Yeah.
who should that person call? I mean, do they call you? Do they call the CDC? Are they calling 911? Who are they supposed to call?
They should call, probably at this point, they can call up the health department,
Okay.
or they can call an emergency room, one of the local hospitals, and make sure that that hospital can test for coronavirus. That hospital might suggest that the person come in for testing. Because right now, I think we're at that stage where they want to test people to get a sense of who is infected. And the hospitals are trying to be as prepared as they can for the exposures that they're getting there. But yeah, the main thing is that you need to find out if the hospital can test, and probably go to the hospital.
Okay. What are you hearing from other people and other
And people should
doctors?
have, people should have masks at home, particularly. Not so much, the mask is not going to protect them from somebody else, but if they get sick themselves, putting a mask on can be protective to other people. So they put a mask on so they can go to the hospital. They put a mask on so they can get the help that they need.
Yeah,
I'm
because
just
we're hearing so much mixed information about these masks. I think people are so confused. Should you wear the mask? Should you not wear the mask? So you're saying,
I don't think it's useful to wear the mask, particularly because these masks are not designed to really filter out this virus. And you have to have the right mask. It's a whole story. The point is, no, I don't recommend people walk around with masks. What I recommend is having masks so that if you are sick and you're home with your family, you put your mask on to protect you from the family, to protect you when you go to the protect them from you. You're not
okay.
helping yourself, you're helping others.
What if you, yeah, that makes sense. What if you need to go to the city, to Manhattan right now, you have to hop in an Uber, you have to get a Metro North, you have to take the subway. What's your advice around that? Do you think that you should avoid doing that right now?
I don't, I don't know the right answer, right? I think that there's a balance, right? So at some point, you still have to live your life, and you can't live in complete fear. And we all can't just lock ourselves in our apartments and homes and wait for this thing to pass, right? So we do have to go on with our lives. But I think you do need to be cautious. You do need to avoid touching your face and putting your fingers in your eyes and your mouth, which I probably did like 5 times since we're talking, by the way. Very, very, very easy to do, and not that easy to stop. Washing your hands frequently, using the antibacterial gels and things like that, which are so hard on the hands, I know, but may kill some of the viral particles. And listen, if you have things to do, you have to do it. If it's something that is maybe for pleasure, maybe it's optional, maybe those are the opportunities that you sort of say, okay, I'm going to skip. But if you have important meetings that you have to go to and you're not sick, just be cautious.
What about making your own hand sanitizer, which you see everyone doing right now online? Should you do that? There's conflicting stories about that as well. Some outlets are saying don't make your own sanitizer. Others are giving you instructions on how to make your own hand sanitizer. So, what's the correct advice there?
Yeah, I don't know. There are ways to make hand sanitizers that have essential oils and can be a little bit safer than alcohol, but I don't know their efficacy against this virus. So I'm hesitant. We know that alcohol-based hand sanitizers do kill the virus. So I'm sort of the opinion that if we have some research that says that that's working, why change it?
Okay. What about, I read something last night about these UV products
Mhm.
that typically, like, you can get them to clean your retainer or to clean baby bottles or even to clean a phone. And so those were selling out fast on Amazon. um, those were sort of new to me. So what do you think about that whole area of products? Are they helpful in cleaning your stuff with or without coronavirus?
Yeah, I don't know. What we do know is that UV light can kill. We use UV light. I'm starting a new IV in my office using UV light and ozone for people who have chronic Lyme disease and chronic infections. So there's a way to sort of use the UV light on blood to sort of purify it and get the infection better, right? So we know that UV has a lot of uses. I don't know about these pieces of equipment. I don't know what kind of UV light it's using. I don't know, what their efficacy is. But it's true that UV does have some, antimicrobial properties. In nail salons, they often use this UV. They have a UV machine. They put their tools in.
Oh,
Have you ever seen them? Like
oh
those
yeah.
little white boxes. They open it up. That's a UV sanitizer.
Yeah, I was looking last night on Instagram, and it seems like a lot of new moms use these products as well to put baby
Yeah,
bottles and pacifiers in there. And apparently, I mean, it was a whole new world to me. I wasn't aware of this, but I guess they make it too for your toothbrush. You can use it.
right.
So,
Yep.
um, and so what about your cell phone and the germs on your cell phone? Because that's another area that I think people are now waking up to.
Yeah.
How dirty is your phone?
Oh, the phone is horrible. People walk around with their phones. This drives me crazy. They take their phone into public bathrooms. They put it down on, the toilet paper holder, or whatever, right? Where it's just picking up all, you flush a toilet, all those germs fly in the air, get on your cell phone. The cell phone is like as dirty as a bathroom, essentially. So yeah, you have to clean it. What I do is I at least once or twice a day take alcohol, like a little alcohol pad, and I wipe the whole thing down with alcohol and I let it dry.
Really?
Now, I will tell you that they don't recommend that at the Apple store. And in
Yes.
fact, the guy said, don't ever use alcohol. Now I don't know, I have like a silicone cover and I have a glass protector on it, and I don't care. I'm not touching my phone until I've alcoholed it. And I do it, sort of like in the middle of the day, and then I do it when I go home from work.
Have you ever told patients that they should clean their phone and this is definitely something they should do?
You know what? It's something I haven't thought of, but I will now.
Yeah, I'm also wondering because I've heard, like, I mean, can your phone be the source or a hidden source of acne on your face? If you're using this dirty cell
Yeah.
phone and putting it up to your face, have you seen
Yeah,
that?
definitely. Yeah. And first of all, because it's dirty, and also because of the EMFs, we know that the electromagnetic frequencies that come off the phone are really kind of toxic. And so people who are really susceptible could get in, their immune system gets disrupted with the EMF. So it's probably like a bad combination. You should never
Wow.
put the headphone to your ear anyway. You should
What
never
about wearing the AirPods and putting those?
ever do that.
Are those okay?
So not really. Yeah, AirPods are not good because they're Bluetooth, and so you're waiting for the signal to come in, to the earphone. It's a I don't know how to explain. I'm certainly not an expert on this. You're better off with headphones that plug in to the
Wait,
phones.
like these old school ones, like something
Those
like
are the
this?
best. Yeah,
Really?
yeah, yeah, definitely. Or if you're going to use your phone, put it on speaker, put it away from your face, that kind of stuff.
Wow, so much
Never
great
put
information.
never put your cell phone to your ear. Like as you're waiting for, let's say you put the number in, you put it to your ear and you wait for it to connect.
Hmm.
That connection period is the worst. So you always want to make sure you don't put it in the ear until they pick up. If you're
Really?
getting,
Why is that? I've never, tell us why that is.
yeah, I just know that that's when the highest amount of EMFs are really.
Wow. That's
Yeah.
so interesting. So much great information here for
Sorry, it's off
anyone who's
topic,
watching.
but
I know people were really excited to tune into this, and I want to make sure now that we're halfway through that we're going to address some of their questions.
yeah,
Do you see any of their questions coming in
yeah,
on here? Because there's a
yeah.
lot, and when I go to press this, what's going to happen is then it's going to pick up the sound. See, it's
I'll
going to
do.
pick up the sound. So I'll
No,
let
I'm
you.
good. I have them here, so I can look.
Perfect. Okay.
So a lot of people are asking about MCAS,
Okay.
mast cell activation syndrome, and want to understand, how this could potentially affect them. And the reality is we don't know, right? Because we don't know if any MCAS patients have gotten sick with coronavirus. So we don't have any data to say specifically this is what to expect. What we do know is mast cells are involved in protecting you against infection. We know the flu will kick up mast cells for sure and cause a mast cell flare in many MCAS patients. So we expect that it potentially could do the same thing. And what can be done about it? Yeah, I mean, again, you can prevent only so much. Some of this is really out of our control. You make sure you have all your MCAS emergency meds around. You do your best to stabilize it, before something happens. And then you get the care that you need, and you make sure that everyone knows that you have MCAS. But it's a question that we don't have answers to yet. So we're all kind of, I'm guessing, what to expect.
Okay. What else are they asking? I'm not.
Um, so let's see. So, well, someone was asking about the immune system, and most MCAS patients have an overactive immune system. Is that to our advantage at all for this, or is it worse for us?
It's an interesting question.
And it is confusing. Somebody said, well, is it really that the system is working overtime, or it's not working well enough? So, the way I think about MCAS is that, well, the way I think of the immune system is that we have multiple areas of the immune system, and you could have one area work really well and one area not work that well. So in MCAS, it's an overreaction of one part of the immune system, but but it could also mean that there's another part of the immune system that is not working as well. Doesn't have to be the case, but there's no way to predict it. So I have some MCAS patients who also have autoimmunity. They have very active immune systems pretty much across the board, which means that they often don't get sick. They're the patients that tell me they haven't been sick in 2 years, 3 years, or they rarely get a cold because their system is overreacting to the environment, but in a good way. So it's kind of protecting them. It's not good for other issues that they have, but it's good because they don't get sick very often. But on the other hand, I have MCAS patients who have immunodeficiencies, maybe from the MCAS or whatever caused the MCAS. And so their mast cells are more overreactive. So when they get sick, they're more likely to have a severe reaction, but at the same time, their immune system is weak. So they actually can't fight the infection off appropriately and effectively. So it's really actually depends. MCAS is a real spectrum disorder and syndrome. And so it really depends on the patient. There's no way of knowing how one individual person how everyone's going to react. It's about the individual person.
So, what are some things that you can do to boost your immune system? I know on the graphic for tonight there were some oranges in the background, I guess for vitamin C. So tell me a little bit about that. What can people do? What can they get at the store? What supplements? What foods? What should they be doing?
Yeah. So look, I don't think there's any one solution here. Typically, I want patients to stay hydrated. You want your mucous membranes to not be dry. They're more likely to pick up the viruses through your respiratory tract. So lots of water. I would avoid sugar at all cost. Sugar really just lowers the immune system, makes it more difficult to fight infection. So eliminating sugar and as many simple carbohydrates as possible can only help the immune system. So I think that's a very, very important point. I think eating good quality protein to help the production of your antibodies that fight things. So there's so many things in our bodies that come from proteins. So you need to eat enough protein to maintain that process, and good fats. So, you do your best. It's not going to be 100% effective, but it will help. And in general, when I'm treating patients for anything, whether it's Lyme disease or whether it's even just MCAS, I don't mean it like that, but like they may not have infection, they may just have an immune dysregulation, I'm still treating them very similarly. I really think sugar is bad. It's bad for the mast cells as well. It's bad for it feeds infection. So I really want to eliminate that. There's been some talk in the media, and I know somebody actually asked a question about this. So some people have been talking about colloidal silver. Colloidal silver it really is silver, the metal, but it's made in a way and in very small concentrations that it's not dangerous. If you get a really good product and a safe product that's clear, if you get a clear colloidal silver, it's not brown. It's hard to really get toxic from that by taking too much silver. But colloidal silver is antimicrobial. It has a really great sort of natural antibiotic, antiviral property. And there are different ways you can take it. You could take it orally. You could take it, you could spray it in your nose. You could put it in your eyes. You could put it on, they have gels that you could put on your skin if you have a wound. But not everybody, doesn't mean everybody should go out and buy colloidal silver. And some of my mast cell patients do not do well with colloidal silver. And so it's a little bit hit or miss. Some do really well. And, they take it when they have a cold and they sort of save themselves from that. But others, don't tolerate. So someone asked if MCAS patients have trouble tolerating colloidal silver, and it's hit or miss. But that may be something that we should be, looking into. Zinc is a really important mineral. It's involved in so many enzymatic processes in the body. It's important, really important for the immune system. So some people have been talking about sucking on zinc lozenges or different products over the counter. They think that might be protective against the virus. No one studied this in the lab, so we don't really know. But we do know just in general, there's a product on the market, Zicam, that's a zinc product. It's been marketed for a while to help reduce the length of the cold, the common cold. So, maybe it will work here, maybe it won't. Vitamin D is probably the most important thing. I should have mentioned it first, because there's no question that vitamin D, which is really a hormone, not a vitamin, is involved in so many things in the immune system as well, and does so many things in the body in general. So increasing doses of vitamin D to prevent illness or during illness can be very helpful. And I would say 95% of my patients with MCAS tolerate vitamin D if they find the right formulation.
What about oregano oil? So I went out and I bought that the other day, but I have to tell you, I hear it's great for things like Lyme disease or prevention with that and other things. I don't know if that's correct or not. You can let me know that, but it started to make me feel so tired and so sick. That makes me think something's actually really wrong with me that happened. I literally was so knocked out from just taking oregano oil. Why would that happen to someone?
I think you had a Herx reaction. And that's a Herxheimer reaction is a die-off. And you're absolutely right. It could, of course, I'm not going to diagnose you now, but it could mean that you had something that it was killing.
Yeah, I felt like I was literally dying and couldn't work. So I had to stop taking it. I couldn't do it for like just 3 days.
Yeah.
Is that a normal reaction to taking oregano oil?
It's normal. It is normal if you have something going on.
Okay, but if you don't have something going on, would you notice like that?
Some people, yeah, I'll tell you what people find in terms of side effects. So not all mast cell patients do well on it, but some do. The main side effect that I see with oregano oil is just, it's kind of like, it's a strong oil. It's a strong smell. Like, I don't know if you open the bottle and smell the capsules, right? It's strong, smells like oregano. So some people find that they get heartburn or like burning from it. You have to take it with food for sure. I don't know if you were taking it with food or not. But taking with food will reduce that. But yeah, you have to be careful with some of these antimicrobials. Even colloidal silver, because it kills things, could, if you have something going on, could actually cause, killing of that thing. And if you're not prepared to go all out on it, yeah, you'll just feel worse rather than better. So if you had something else with the oregano oil, let's say you have underlying Lyme disease. I'm not diagnosing you, but let's say you had something and you started herxing with oregano oil, we would be prepared with other things to try to help you get through that.
Well, see, this is where I get a little bit concerned, because you see a lot of people right now who are telling in the news, right? They're saying elderberry, get elderberry, get oregano oil, get all of these things. And then you have someone who could be like me, who may have something wrong. Who knows if I do? And so the media is saying, go do all of this on your own. And then who knows what you have at that point. And right now is not the greatest time to be trying to figure that out. So I mean, this is the information we're receiving in the media and on social media and our news feed. So what do those people do? Because that, to me, sounds like that could be a little bit dangerous. I mean, I went out and I got that because I saw someone say to do it in my news feed. So I can't imagine I'm alone in that.
Right.
So you're gonna have all these people with Herx reactions, and then, they're wondering, is this coronavirus? Is it a Herx reaction? What's going on here? And then they just stop. So what should they do?
Yeah, and that's why I'm even concerned talking about this now, because I worry about people, sort of self-medicating themselves, even with the natural stuff, and still ends up having side effects. Listen, I think it's better if you could talk to a healthcare professional, preferably somebody who has some knowledge about vitamins and supplements. So, if you had called me, I would have said, all right, do this, do that, don't take that, let's watch that, right? So my patients know that they can, that I can help them in that regard. I hope others have that relationship with doctors, that they can kind of figure out what's going to be best for them. These are all things that could be helpful for viruses. Elderberry, vitamin C is another one they're talking about, megadose vitamin C, high dose vitamin D, high dose vitamin A, zinc, etc. Right? These are all great. Doesn't mean that you should go home, buy them all, start taking them. No. And that's why I think you do need to have some guidance.
Do you get concerned about people playing, doctor and self-prescribing things based on what they read on social media? They see something on Facebook in their news feed. I mean, does that worry you at all?
You're talking about doctors prescribing it
People
based on?
playing, no, people playing doctor, people
Oh,
like me who
people.
are reading their news feed, and someone else said it, the other person's not even a doctor, they're not a medical professional, but then they're following their friend, from Idaho's advice because someone said to take it. Does that worry you?
It does. And, it does backfire. So sometimes, the patients come in and, they'll say, oh, by the way, I heard about this. So in the meantime, until I saw you, I tried, X, Y, Z, and I had this reaction. That reaction wasn't good. So yeah, sometimes I see that and I think, oh gosh, if they had told me, I probably would have told them not to try that. But, sometimes people are fine, and sometimes people are not as sensitive. Patients who don't have MCAS can tolerate a lot of things, could probably play doctor and not get into trouble.
Hmm.
But, you have to remember that some of these vitamins, while they're vitamins and healthy, so first of all, you need to make sure you know what brand you're buying, because you don't know what's combined with those vitamins in fillers. And some of the things on the market are shocking to me, what they're adding into vitamins, like food dyes and all these other chemicals, things like propylene glycol, and I think why is that in a vitamin? So you don't know what you're getting, right? So that's a problem. And then you don't know what to do with it, and you don't know if it interacts with. You don't know the dosing. You don't know if it interacts with any medications you're on, because there are herbs that will interfere with medication. So for instance, if a patient has a history of breast cancer and is taking tamoxifen interferes with a lot of mechanism, a lot of the metabolism of herbs. And so you cannot take herbs when you're on tamoxifen, or there are very few herbs, and they have to be approved by your oncologist. So what I worry about is, you have a condition that, could get worse, could affect a drug that you're taking, cause more worsening side effects from something that you're just, read about. So.
Wow, that's super scary. And bringing it back to MCAS for a second, the other thing that concerns me is that, they're talking about increased cleaning everywhere you go right now because of coronavirus. So if you are someone who is typically going to react to these things and these cleaning products or different chemicals, I mean, everywhere around, they're saying we're going to be dousing everything in chemicals right now to make sure it's clean. So would you say that the likelihood for a reaction could increase during this time when we see the increased, cleaning supplies being used everywhere?
Yeah, particularly bleach. I think I was listening to the news where they were recommending bleach in
Yep.
particular be used, to clean all the surfaces. And I think one school was saying that they were using bleach every day to disinfect. Yeah, bleach is, I mean, how many people, even people who don't even know they have MCAS, many people know that they're reactive to bleach. It's very irritating to the respiratory tract in general if there's too much in the air. And that's where maybe the masks come in handy
Huh.
to protect yourself just from the smell. So it may not protect you against coronavirus, but if you have to walk into a building that's been doused with bleach and you're afraid it's going to affect you, I would put a mask on.
The other thing is for people who are used to sort of buying organic or natural products the way that they typically like to. Right now, if so many things are sold out, and if they can't get the products that they like, that they know they can tolerate, what should they do? Because there's not many products left.
Yeah, I know. You talk about products for cleaning and things like that.
Yeah, I mean, you go to the CVS or Target or any of these places, like let's say there's a brand you like that you're not going to react to. Well, most things are gone right now. So what should that person do in that situation? They're going to have to change what they're used to using. And I can imagine that could cause some reactions.
Yeah, definitely. And I think it's about trial and error, unfortunately. They may know that there are some products, like, for instance, not all MCAS patients do well with vinegar, but, maybe they know if they dilute it, it doesn't really affect them the same way. And maybe they can use water and vinegar to clean. Does it disinfect the same way? I'm not sure. But maybe it's better than using bleach. So I think that each person really has to figure out what's going to work for them. But we have a problem, right? Things are flying off the shelves in general.
Yeah.
It's going to be harder to get food. It's going to be harder to get supplies. It's going to be harder to get, cleaning supplies in general. Yeah.
I noticed this too with Benadryl, the dye-free Benadryl. There was none left, which was scary to me. I had to go from store to store to get that, special Benadryl. So if you can find it where you are, I would get as much as you can
Yeah.
because it's
Yeah.
selling out. What other questions do we have on there that you can see?
Well, someone mentioned that they're so allergic to the bleach that
Mm.
it goes through the mask,
Oh, wow.
which is a real problem. Now they have stronger masks, and I wonder about those, whether that would help. But yeah, we're gonna see people reacting more. This is, you sort of do something to help one issue, and you cause more problems on the other end, right? So let's see. Yeah, somebody's saying that hand sanitizers are pretty much sold out at this point. Um, let's see. Yeah, someone mentioned, this is really interesting, and I'll do my own research on this, but one of the drugs I've talked about in the past regarding treating Lyme disease is a drug called disulfiram that we're using for Lyme. It happens to be an anti-parasitic drug, and somebody just posted an article, and I'll read it. Can't just trust the link, but it says that it may have activity against coronavirus. So maybe that's for some of the Lyme patients who are already taking stuff, maybe that's protective. We need to figure out what's going to help for this, for sure. I'm looking for additional questions. Let's see.
Oh, I see someone okay. So they wanted to say, I'm curious, other than toxic hand sanitizer, how can we protect ourselves? We have special needs. Luke, who may absolutely will not wash his hands for 20 seconds. We may need to protect him internally, but I don't know how. Thank you.
Yeah. You do the best you can. And if you can't use alcohol, they have wipes and sprays and gels that are made from other natural products. I don't know if those are easy to find right now, but I know there's a company that makes it with thyme oil, THYME, which is an herb that has antimicrobial properties. Some people are sensitive to the thyme oil. I know there's benzoyl chloride, which is benzalkonium chloride, which is found in a few. I know it's found in Wet Ones, I think is the brand. So
Mm.
it has some antimicrobial properties, but doesn't have alcohol. So you could maybe use, a wipe. You do the best you can. I mean, we can't go crazy, right?
Mm.
I started being sort of a little bit of an alarmist, but I want to end saying that some of this is out of our control. We should do what we can control.
So what can we control?
So we can control our diet. We can control, how much exposure we get. In a sense, you can't control everything, but if, for instance, you have an event that you're supposed to go to, but you don't really need to go to, and it's in a location that could potentially put you at risk, so don't go. Right. So there's some things that you can make decisions on, but in general, if it's in the community, it could be hard to even control for those.
Can we also talk just a little bit as we close out here? I know we're in
Yeah.
our last 9 minutes, just about the sort of mental health toll and stress levels that this is taking on all of us in terms of just working day to day. It's adding stress to our lives. I know I personally found it harder to focus with this constant bombardment of news and the, death count going up every, hour from this. What would your advice be to people to get through the day, to work without letting this impact their stress levels so that they can focus and do their job?
It's a good question. Look, I think at some point you have to shut the news off. I was guilty of, last night, it was probably midnight. I really needed to get to bed, but I was like obsessed with like what was going on and reading. And of course, then I couldn't sleep. So, I would say you just got to shut it off. You need to know, but you don't need to know at midnight before you go to sleep, right? Shut it off, take some, really do self-care, take care of yourself, um, take a warm bath if that makes you feel better, take a cold bath if that makes you feel better, take some time to meditate, take a walk if it's a nice day outside, right? Just do things that make you happy, make you feel better, because you have to stress will kill you in its own. Forget the coronavirus too. So stress, it needs to be controlled, it needs to be dealt with. Whatever way feels right for you.
And as you're saying this, I feel like I see notifications saying like California just declared a state of emergency. I'm pretty sure that's what it just said. So I'm just,
Okay.
it
Yeah.
just keeps coming. Like, this is exactly what I'm talking about, where it's like, oh my God, here we go with yet another notification.
Yeah.
I
No,
think maybe some people are better at handling all of that incoming news than others.
yeah, definitely. And I think that some people are better at putting things in perspective and are good about saying, it's not really going to happen to me. I'll be careful, but I'm not going to worry about it, because if it happens, it happens. There's some people who really have that kind of attitude, and so it doesn't, they're not going to be obsessed. But many of us really are more susceptible to what we're hearing about. We worry more about getting sick. We worry about our families and getting sick, and knowing, we sort of anticipate the future and what could happen, and that sort of feeds the stress. I don't know what the right way is. I mean, they're both maybe extremes, and somewhere in the middle may be better.
Yeah, I've had conversations with people about this, and they say, "Oh, well, you're 30 something. You're not the one who's going to get this. Anyone who's 60 plus, that's who you should be worried about." And I say, "Yeah, that's who I am worried about in this. The
Right.
elderly population with this, them getting it, or anyone with these comorbidity factors, if that's the correct way to say it. Someone who's had heart disease or diabetes or these other things.
Exactly.
That's concerning to me, and we saw that too with this nursing home in Seattle and what's going on over there."
That's right. I think it's the wrong attitude to say, you're young, excuse me, you don't have to worry about it,
Yeah.
because you know how many of us have people in our families who are not young
Yes.
and who are susceptible, and so this could touch a lot of people. And even if you get it right, you may not be as sick, but you're still potentially also spreading it. So we know that 30-year-olds can get it. We
Yep.
just don't know, and can spread it. You just won't be maybe as sick as a 65-year-old, but that doesn't mean it's still good, right? So
Exactly.
yeah, I know.
Exactly. Yeah. And I think having that sort of global view around all of this is really important when we're talking about perspective, that it's not just about us, it's about all of the people and the trickle down effect of that and who else it can impact, even if it's not necessarily you, could be your neighbor.
No, exactly, exactly. And as we're talking, somebody is, posting that in New Zealand, 3 confirmed cases as of this afternoon. I think that's new. I don't remember hearing about New Zealand previously. So you're right. Like, this is just going to
Yep.
keep. It's going to keep going. I think we need to be prepared for that. I mean, that's the bottom line. I think that we can't be surprised that this is going to happen. That we're going to hear more and more of this in our communities. everywhere. And we're going to be try to be as safe as possible, and hope in the interim that we have people who are studying and finding things that we can use to shorten the duration of the illness, to stop the illness, maybe to prevent the illness. I know a lot of people are looking at vaccines. I'm not sure that a vaccine is the right route, but I'm certainly not the expert there. But I definitely would want drugs and antivirals that could help, again, help this disease resolve quicker and
Okay.
more safely.
And to close here, I know you've already sort of talked about this, but to close, for anyone who says in your newsfeed, don't worry about this, this is just the flu, wash your hands, it's no big deal, what would you say to them?
So what I would say is that we are at the tip of a big iceberg, and we need to be prepared. We don't have to be hysterical about it. We need to be smart, but this is a problem. This is going to get worse. It's going to affect more people. There are going to be more people who are going to know people who are affected by this. And I don't want that to be what sways these people to believe in what I'm saying, but I think that we just have to understand that this is different than other diseases that we've been affected by, and we can't just lump it with the flu or something else. This is different, and we have to be respectful of that. We're going to see this, transpire in a way that we've never seen anything transpire.
Wow, that's so powerful. Thank you so much for doing this. This has been so great. I know you were seeing patients right up until the time you started. And so Dr. Dempsey made time in her schedule on top of everything else to make sure you guys got all the information that you needed on this so that she could speak with you directly. So thank you for your time. I really
Thank you.
appreciate
I
it.
think this was really important. I really wanted to do this.
If you guys have any other questions, feel free to leave them in the thread. Dr. Dempsey, I know she tries to get to as many of these as she can. At some point, she still has a family to go home to right now at 8:00. So
Sleep. I need to sleep. And that's one thing, talking about prevention, sleep is so important for the immune system. So I'm trying to get more of it.
yes, I know you're still sitting there in the office right now, so I'm going to let you go. Thank you for doing this. And thank you all for tuning in and joining us, and stay healthy and safe out there. Thank you so much. Have a good night, everyone.
Bye.